Thank you very much. It's a very, very valuable information and assurance that you have given Dr. Mahapatra. Now, may I request Professor R.K Sharma, Director, SPG, Lucknow. In fact, he is the most valuable partner as far as OTET is concerned, because you know possibly the SGPI Lucknow is the crown jewel of telemedicine in the whole country. They are the coordinating center for the whole country, and they have started also for the last so many years. They have already conducted a number of education programs for doctors in Odisha for the 5-6 years, and now that they have been giving all the help, assistance and cooperation to OTET, I think I request Dr. Sharma to please speak a few words.
Good evening, ladies and gentlemen. Respected Honorable Minister Sri Prasanna Acharya and all the dignitaries on the dais. First of all, I would like to thank Mr. Bhagat for giving me this opportunity to be here. I have visited Bhubaneswar and Puri a couple of times, but that was mainly, I'm basically a nephrologist and a transplanter for our nephrology meetings. And Bhubaneswar has always attracted me. So when Mr. Bhagat asked me to come, I was more than willing to come here. Also because our institute has been collaborating in the area of telemedicine with Mr. Bhagat and this trust, and it's being the foundation day, I think it's very important. And when I knew that Honorable Minister and all the dignitaries would be there, so this would be an occasion to interact and make some points here. The story of our telemedicine is very interesting. And I can tell you, it was started by doctors who had no knowledge of telemedicine, electronics, and all the specialized fields. I remember when CDAC came to us for making the hospital information software, all of us as clinicians, they contributed, and it was a project which was taken, and ultimately with a lot of sincerity and enthusiasm. And this interaction made us interested into the various areas in which, and this was a long time back, when our center was actually one of the first centers to have a paperless hospital information system established, not only in the government sector, but even in the corporate sector. And then we went into this area of telemedicine. And I must congratulate the central government and also the UP government, who have contributed immensely, both in terms of the moral support and also from the financial point of view. And ultimately, we have a center which has the infrastructure which is second to nowhere else, at least in India and in some way internationally. And what is required is that it has to be used optimally. And that is where lies the importance of interaction and collaboration, both with other government organizations and with the public organizations. First, I would mention some of the government monitored interactions which we are having. Our center has been accepted as a national resource center, and also for medical education, as Dr. Mahapatra was mentioning. He has been a very important mover of the whole show by the Medical Council of India, and recently about 20 crore grant has come from the central government to have a telemedicine network all over the country, and our center would be the nodal point. And the other area in which I think, though our institute is a super specialty center, but we have to contribute for primary and secondary care as well. The secondary care, we are getting involved in terms of tele-education, but the primary care involvement is where Mr. Bhagat has a very important role to play. And I would say that the government of Orissa is an example which other states really can copy, that this is one state which appears to be going in a direction of really using the telemedicine concept for giving primary care. And our center is very committed to really provide all support, especially training for the paramedics, the ANMs, the ASHA, because they would really be the core group for giving primary care at the grassroots level. I have been in Planning Commission in their health subcommittee, and now the whole planning for the next 5 to 10 years is almost at the final stages. And what the Planning Commission is very seriously thinking to provide health care for all. Dr. Mahapatra is very right that seeing the complexities of the Indian scenario, it is very difficult to do. But it has to be done. And the first important thing how it can be done is so many reasons that it is so difficult to do. You can understand that the population of the whole state of UP is equal to the population of United States. And in the United States, we have 100 institutions of the type of Sanjay Gandhi PGI. So these are some of the issues which come up, and this gets more complicated when we are talking of the primary care. Like Honorable Minister was talking that the situation which exists at the grassroots level is not only very complex, and sometimes it appears to be very depressing. But we have to go forward, and we have to have innovative approach. And I think telemedicine could be one innovative approach in which it could help. Dr. Mahapatra mentioned about the paucity of doctors. It is really a very serious matter. And recently, you must have read in the newspaper, this has been also at the behest of the Planning Commission, and Medical Council of India has also given okay for it. They are now going to start something like a graduate course. You can call it an MBBS for rural areas. These doctors who will be going through a capsulated course, which would be recognized by the government, and they would really be allowed only to practice in the village area. I know some of you may come back and ask me, how do you prevent them from practicing in the cities? Those problems will come, but we have to take up these innovative areas. As Dr. Mahapatra mentioned, as soon as you talk about telemedicine, some people start making fun of the whole concept. But you have to really understand how it can be used. And the concept is not only innovative, it is something very, very practical. I mean, we are not going to do very advanced cardiac surgeries or neurosurgeries using telemedicine. It can be done because now you have robotics and so many factors. But we are planning to use it at the grassroots level to give primary care to people who are sick. And I think the endeavor by Mr. Bhagat is really something which we should appreciate. And I would like to congratulate him. He has come to Lucknow repeatedly, and we have had some meetings, and I have been very much inspired, not only by his commitment, but by his spiritual thinking in the whole commitment to the cause of the poor. And I would end this note from my side by telling you a few lines from Yoganandji. In his book, The Autobiography of Yogi, if you have read, in one of his speeches, he was mentioning that the power of thought is so immense that you can create so many things. And this has also been proved now by a scientific way, because the thought process has so much of energy. But what he has mentioned, the thought process will be very powerful. It would create what you want, provided it has few fundamental requirements. The requirement should be your commitment, and it should be done with love, care, and service. And this is what, when I was going through all the pamphlets which were there about this trust, everywhere it was written, love all and serve all. And I think this is the thought process which really is the bottom line with which Mr. Bhagat is working. And that's why he is succeeding. That's why he's been able to sell this concept of using telemedicine, training ASHA and ANMs, and then using them for giving primary care. So once again, I would take this opportunity to congratulate the Honorable Minister, the Government of Odisha and Mr. Bhagat for their endeavor. And I am very hopeful that very soon, not only in the state of Odisha, but all over India, we would be able to provide at least primary health care for all our citizens. So once again, I thank the Trust and the organizers